failed back syndrome, FBS, or failed back surgery syndrome, FBSS, is a condition involving consistent back and or leg pain following a back surgery or series of back surgeries. Failed back syndrome is an all too common condition we have seen at West Texas Chiropractic Center over the years. What is failed back surgery syndrome? Failed back surgery syndrome, often also known as a post-laminectomy syndrome, occurs when a patient suffers from lumbar spine pain and surgery to rectify it is failed. When surgery is not able to treat or correct lumbar spine pain, patients are left with long-standing, chronic, and often intolerable back and leg pain. The lumbar spine makes up the lower part of the back that provides structural support and movement. The bony lumbar spine consists of vertebrae that are meant to protect from spinal cord injuries and provide function and movement to the body. Pain in the lower back could be caused by many different reasons, including lumbar strain, pinched nerve, and other conditions of the bone and joints. The Verywell Health research published a review stating that the failure rate of back pain surgeries is over 74%. This alarming percentage of non-recoveries is a prime example of how many people continue to live in pain and agony after surgery. The purpose of spine or back surgery is to stabilize a joint that is experiencing chronic pain and/or to decompress the root of a nerve that might be pinched. A high number of cases, however, continue to experience pain, discomfort, and much disappointment from failed surgeries and continue to rely on heavy doses of pain medication or expensive medical treatments that need to be continued for years to come. Some patients even consider surgery revision to rectify the problem. This, however, should be the last attempt or option when experiencing failed back surgery syndrome. Causes of failed surgery and continued back pain after surgery. There are numerous reasons that result in failed back surgery syndrome. They are misdiagnosis of pain etiology. An accurate preoperative diagnosis of the patient's cause of pain is one of the most important factors that contribute to the success of the surgery. Diagnosing the source and cause of a patient's back or spine pain increases the chances of being able to correct the problem through surgery. Post-surgery rehabilitation. A person's mental and physical state is important as much as treatment follow-ups are. A patient who is active and proactive is most likely to recover faster than a patient who does not make the effort to exercise or retains a negative mindset about the possibilities of recovery. Obesity. A person who has excessive weight or is extremely overweight could experience greater difficulty during and post-surgery. Spinal Fusion Surgery. Spinal fusion surgery eliminates the ability of the spine to move in the area of pain. The surgeon commonly adds a bone graft and creates a response that causes the bone graft to grow between two vertebrae. The vertebrae fuse and create one fixed bone instead of a mobile joint. After a spinal fusion surgery, pain often transfers to the next level in the spine because the cause of the problem is a spinal fusion surgery is not eliminated. Additional torque and pressure are then transferred to the adjoining vertebrae. West Texas Chiropractic Center uses the chiropractic approach that increases mobility in the spinal joints by addressing the cause of pain and treating with non-invasive, safe, gentle mechanical adjustments that realign the vertebrae and free the nerve roots. Dr. Winchell also uses cold low-level laser therapy to eliminate swelling and stimulate the body's healing response. Following a failed spinal fusion therapy, we will the adjoining vertebrae to relieve pressure created by the fused vertebrae. Lumbar Decompression Back Surgery. During lumbar decompression back surgery, a small part of bone or disc material is removed to give the nerve root more space. After cutting away the impeding material, a spinal fusion or spacer implant is often necessary to keep the compression from returning. Unfortunately, spinal fusion causes pressure and imbalance to the adjoining vertebral joints, which leads to dysfunction, pain, and the start of a disorder in these joints as well. West Texas Chiropractic Center's natural chiropractic approach gently aligns the vertebrae without surgery to remove the pressure on the nerve root and allow the body to heal and pain to be eliminated, along with the problem. With the realignment approach, the cause of the problem is removed, not your bone or disc material that your body needs for proper functioning. Scar tissue post-surgery. As part of the healing process, the body forms bands of scar tissue after any tissue injury, such as with spine surgery. This scar tissue can pinch a nerve root, causing a condition called epidural fibrosis, which can lead to post-surgery pain and failed back surgery syndrome. After back or spine surgery, biomechanical changes to the area can cause a progression of degenerative changes that can increase tension or result in central stenosis. Spinal stenosis happens when the spaces in your spine begin narrowing or getting smaller and exert pressure on the nerves in and around the spine and lower back area. Untreated stenosis can lead to permanent nerve damage and paralysis. In central stenosis, the central canal of the spine becomes constricted with ligament or bony overgrowth. Non-surgical spinal decompression. Non-surgical spinal decompression is a type of motorized traction therapy that relieves and treats pain effectively through a series of gentle stretching of specific targeted areas of the spine. This form of therapy, which is different and stronger than conventional traction therapy, is extremely effective in providing pain relief for patients struggling with failed back surgery syndrome and chronic low back pain caused by sciatica, disc degeneration, lumbar disc herniations, pinched nerves, and other spinal and lower back ailments. Unlike invasive and painful treatments and surgery, non-surgical spinal decompression uses techniques that are relaxing and soothing, effectively reducing pain while enhancing mobility and functionality. It reduces pressure off spinal discs, nerves, and other structures in the spine, promoting the movement of fluids and oxygen for quicker healing. Benefits of chiropractic care and non-surgical spinal decompression. When done by a trained healthcare professional and administered with care, chiropractic and non-surgical spinal decompression treatments can become an integral part of reducing low back pain from failed back surgery syndrome. There are many health benefits to receiving these treatments when you are experiencing failed back surgery syndrome, including pain reduction and management. Chiropractic care and non-surgical spinal decompression are highly effective at reducing low back pain that continues or is worsened after back or spine surgery. Patients who struggle with failed back surgery syndrome are great candidates for these treatments, and many patients claim to experience relief shortly after beginning treatments. When chiropractic care is administered correctly by a trained chiropractor and is done on a regular basis, patients enjoy the benefits of effective pain management and reduction without the use of pharmaceuticals, addictive pain medication, or further surgery and invasive treatment options. Improve joint mobility and functionality. The gentle techniques of chiropractic treatments help increase range of motion in patients who experience pain, joint stiffness, or temporary and partial paralysis due to failed back surgery syndrome. By aligning joints and vertebrae in the lower back region, patients are able to function more efficiently and with long-term care and treatment can regain